Hello, my name is Coach Chanae. Welcome to Academic Coaching for World Changers. Today, I will be sharing with you information about suicide, including information related to risk factors and protective factors. Before I get started sharing this information, I would like to remind you that you can see more videos such as what I'll present to you today on our YouTube page. While you're there, please remember to like and subscribe. You can also find out more information on our website, academiccoachingforworldchangers.com. On our website, on our website, you'll find information about all of our coaches who can help prepare you for your test. You'll also find information about tools that we have to offer you that can help prepare you for your test. You'll find information about groups, individual sessions, tools, and things that can help you focus and prepare to pass your tests. Before we get started, I'd like to also remind you of how we learn here at Academic Coaching. We use Bloom's taxonomy. Using Bloom's taxonomy is a way to help us understand how we learn. Here we remind our test takers that it is important for you to study. We recommend you studying at least 4 hours a day, 2 hours in the morning and 2 hours in the evening. When you do that, it helps you remember the information, and it's important to be able to recall your facts and basic concepts. You want to be able to define, list, memorize, and repeat that information. In order to do that, it will take you about 4 hours a day. It's only a moment in time in your life. You won't be doing this forever, but to pass the test, you must take time to prioritize yourself. Focus 4 hours a day, and you will be able to remember the information and understand the information. When you understand it, you're able to begin discussing it and explaining it. You should be able to explain some of the basic concepts that you are studying to maybe your peers, your partner. You should be able to discuss and explain this information, what you are learning. And then you can apply it. You will begin to implement the information in order to solve problems, to answer your questions. You will apply the information you're learning to questions. And that's when you know you're learning. You analyze the information, you evaluate it, and you create it in order to make it your own. You begin to construct the information and develop and formulate it to make it your own information. That's when you know you're ready to pass this test. You got this. You got this. Remember, this is just a reading test. All the information in each question is given to you. Use the information provided to you in order to answer your question. It's just a reading test. So we'll get started reading this question together. You can pause, read it to yourself, and take some time to think about it, but we'll go through this together. The question today is saying you're a medical social worker employed at an emergency department. You are evaluating three different patients who have come to the emergency department in crisis. All three have been assessed by the nurse and are ready for a psychiatric assessment. Which of the following patients should you prioritize based on the level of risk? So we have to think about what this question is asking us. And they're asking us, how would you prioritize the level of needs when you have three clients who are presenting with some sort of suicide concern? So let's read the question, read the answers, the responses. We'll read all three of them and think all three of them through. Even if we think we know the answer, it's important that we read all three responses. And as you know, how we do here, we begin to rule out responses and have a rationale as to why we're ruling them out until we come to our correct final answer. So, a patient who has made statements of wanting to die and who has started giving away belongings. B, a patient who reports feeling hopeless and having thoughts of suicide without a specific plan. Or C, a patient in outpatient therapy who comes to the emergency department after feeling overwhelmed by a recent job loss. So, Again, we know that this is a reading test, and so we're going to think about this question again. Which of the following patients do we prioritize based on the level of risk? So we want to think about what we know about suicide, risk factors, and protective factors, and determine based on this information who should we see first. They all may need to be seen, so all answers may be correct. However, one's prioritized needs should be first. So we think about the question, we're in an emergency department, we're evaluating three patients. They all have been assessed by the nurse and are ready for their assessment, psych assessment. Who would we go with first? So the question is asking us to put ourselves in the position of the social worker. And we want to look at the three clients and rank their needs from the highest to the lowest needs of imminency. So let's talk about suicide risk factors. And what we know about risk factors, these are like warning signs. These are things that speak to there's an increase in danger. So when we talk about risk factors, these are things that speak to experiencing thoughts of suicide. We want to, the questions on the test will speak to uh, what presenting risk factors increase the chance of knowing someone is going to hurt themselves. So when we think about risk factors, these are things that increase the chance that you're thinking about suicide. Some examples of that would be you have a history of mental health. You have a past attempts of hurting yourself, past attempts of committing suicide, attempting to commit suicide. You have substance abuse concerns. You have feelings of hopelessness, or maybe something recent has shifted in your life, maybe like a recent job loss, a recent separation. These are all situations that increase your vulnerability, especially when you have several of these risk factors that are present at one time. So these are risk factors you think of what speaks to an increased danger to this person. So as we said, history of suicide attempts before, serious mental health issues, a current loss, current feelings of hopelessness, those are all flags, immediate red flags for increase in danger, warning signs. Those are things that help us think about a risk factor. So let's talk about protective factors. Protective factors are somewhat opposite. That is more thinking of an increase in safety. So these are things that decrease the likelihood that someone is going to cause harm to themselves. So it's important to rank these from the highest to lowest to kind of determine how much protective capacity, how much are they willing to plan for safety. Those are what we consider protective factors. And so examples of protective factors could be you have family supports, you are engaged in mental health services already, you have a reason for living. You have family, you have children who are looking to you for guidance. You have coping skills that you use that are successful to you. Um, so using your family support, that you have social supports, things like that are what we look as protective factors, things that are increasing your chance of being safe, the factors that increase the likelihood that you want to commit to safety. These are suicide protective factors. So let's look at them on this chart. The warning signs of someone who is thinking about suicide, someone who's become withdrawn, less engaged with their family and friends, drastic mood changes. You're more easily irritated, agitated, you sleep all the time, increase risky activities, including substance use, drinking, using drugs. You begin to give away things that matter to you. You give away your personal items. These are all warning signs when you are beginning to think about, I'm not going to be here anymore. You are saying goodbye to people who are important to you. You begin thinking about ways that you can end your life, thinking about going to purchase a gun, storing your medication, using your medication excessively. These are all things that are warning signs, risk factors. Protective factors. are things that increase your likelihood to be safe. So you're engaging in social activities, you're using your regular activities, continuing your relationships with friends, family members, you're reaching out to people, you're using your coping skills when you're feeling overwhelmed, you're engaging in physical activities such as going for a walk, fitness class, again, using your coping skills. You work on developing new skills or hobbies. You're keeping healthy, safe, healthy diet and sleep, excuse me. You're talking to your therapist about ways to manage your stress. These are all protective factors, ways that you're thinking about increasing your safety. So let's get back to the question here. You're a medical social worker employed in an emergency department. You're evaluating three different patients who have come to the emergency department in crisis. All three have been assessed by the nurse and are ready for a psychiatric assessment. Which patients would we prioritize based on their level of risk? So again, who are we prioritizing based on their warning signs and their increased likelihood to cause harm and danger to themselves? Would we prioritize the patient who has made statements of wanting to die, who has already started giving away their belongings? A patient, do we prioritize the patient who reports feeling hopeless and having thoughts of suicide, but with no specific plan? Or do we prioritize the patient who's in outpatient therapy who comes to the emergency department after feeling overwhelmed by a recent job loss? So remember, there could be more than one correct answer here because we want to see all three of these clients. However, who do we prioritize? So we can begin ruling out our responses. We may think we know the correct answer, but it's important to take time to read all of the options and have a reason why we're ruling out options. So we would begin ruling out C, a patient in outpatient therapy who comes to the emergency department after feeling overwhelmed by a recent job loss. Now, this person has a recent loss in their life. However, they're in services and they have those are that's considered a protective factor. So this person would not be the first person that we say we need to see. Although they are feeling overwhelmed and have had a recent loss in their life, there is a protective factor there. So we would rule this out because A and B seem to have a few more risk factors than protective factors. So we would then begin to rule out B, a patient who reports feeling hopeless and having thoughts of suicide without a specific plan. We would rule this person out as our priority client because although they are having some serious risk factors, they are hopeless and have thoughts of suicide, they don't have a specific plan. So they don't have a thought of how they're going to do it or what they want to do. They just know I am having thoughts of suicide and I'm not feeling the best and I need an intervention. So we would rule out B as our priority person because they don't have a plan. I would leave our last answer as, oh, I'm sorry, this should not be on here. I would maintain our answer as A. The person who has made statements of wanting to die and has started giving away their belongings to the high is the highest risk person. They should be assessed immediately. This person has already begun making plans to give away their belongings, and that really suggests immediate, imminent danger that someone is going to harm themselves. When you have made statements of wanting to die and have begun taking steps to relieve yourself of your items, that speaks to immediate risk, highest priority. I hope that was helpful in understanding risk factors, protective factors related to suicide. Again, remember, you can find more videos like mine on our YouTube page. And remember, while you're there, to like and subscribe. You can find me at Coach Chanae at Academic Coaching for World Changers at acwc@gmail.com, or you can find us on academiccoachingforworldchangers.com. Thank you so much.